All right, welcome and thank you for joining. My name is Angelica and I'm a health educator for community health at Atlantic Health System. Today's webinar, Nurturing Wellness, Celebrating International Self-Care Day, is presented by Sharon Kelly. And before we get started, I'd like to share these announcements with you. This webinar is being recorded. All participants are muted. If you have questions, please use the Q&A button at the bottom of your screen. You can use the chat box for comments, and we'll try our best to get through all of your questions at the end of the presentation. At Atlantic Health System, we encourage everyone to be an active partner in their healthcare. We recommend using an online tool called MyChart to help you manage your care. MyChart is an interactive tool that gives you 24/7 access to your electronic medical record. It's available to all patients of Atlantic Health System, including doctor's visits, vaccine visits, and emergency room visits. If you're not a patient at Atlantic Health System, you may have access to MyChart or similar platforms through your usual provider. MyChart allows you to manage many aspects of your healthcare. Some of the most popular features allow you to request your medical records, to access your medical information, your test results, medications, diagnoses. It also allows you to send non-urgent messages to your provider's office or request your medication refills. You can also view any clinical notes or after visit summaries in the MyChart. You can schedule your appointments online and check in for appointments as well. You can also view and pay hospital bills online, and you can also share your MyChart access with family or friends and vice versa. So for example, you can get access to your child's MyChart so that you can manage your whole family from one account, or you can add a senior parent and get who can give access to their adult children. There are lots more features available to help you manage your care. If you want some help with setting up MyChart account, you have this QR code here on the screen that'll take you to the login page, and there is support for MyChart available 12 hours a day, 7 days a week. Now I'm going to hand it over to Sharon. Thank you, Sharon.
All right. So thank you so much. Angelica said, my name is Sharon Kelly. I'm a licensed clinical social worker and I work for Atlantic Health. I've been honored to be able to work with the employees of Atlantic Health for over 20 years. And a lot of what I do is really helping people figure out how to answer this question, how do I take care of myself so that I can take care of, my loved ones, my community, and my job and my work. And so this idea of celebrating International Self-Care Days, it's amazing. It's great. And I'm so glad that those of you who have been able to make it are here. And those of you who are perhaps looking at this later in the recording can benefit from this as well. I want to ask you, and you can either do a chat and then, put this in the chat. You can save questions for later, as Angelica said, but when you hear the word, the term self-care, what comes to mind immediately? Like, what are the associations that you have when you hear that concept of self-care? I'm going to guess, and you can put it in the chat just because it's kind of makes it more interesting for us to hear from others. But for your own benefit, just jot it down on a little piece of paper because it can be kind of revealing to see what our initial response is to something like that. I'm going to guess that some people might think the first thing they think of is indulgence, being spoiled. Maybe they think, oh, spa day, a getaway at the Fiji Islands, or maybe it's, oh, a mani-pedi where I can get out and, take care of myself. So they might be thinking escape, or they might, have other associations. So just let yourself notice what comes up for you when you think about the term self-care, because this could be helpful as you figure out, how am I going to increase my self-care? What's the point of it or the benefit of it? And it helps us to know what our barriers might be to getting self-care. So we're going to go over the history briefly of this International Self-Care Day, just so we have it in context. It is the reason that we're all here today. We want to talk a little bit about some of the reasons that it might be beneficial to include self-care in your life. And we want to go over some concrete steps that you can take to begin to create your healthcare plan for yourself. All right, so we're moving to the next slide. So a brief history of International Self-Care Day. You can look at this more deeply at this link here, the International Self-Care Day link, Calendar Fest, which gives you all kinds of information that you can draw from, and you will have access to this post after we finish the talk today. So if you're interested in taking a deeper dive, take a look at that. It's interesting, and lots of good, fun, helpful information is included in that website. It kind of goes back, and actually the timeline on the calendar and this website goes back really far. But for our purposes, we're taking it back to the 1950s, where the medical community began to think about this and coined the phrase, came up with the phrase that people might be needing to do some self-care. Really hadn't been in the community language prior to that very much. There was a feeling that was roaming around soon after that began to see self-care as a little bit of a lightweight thing, a little frivolous, not really that serious. Maybe, overindulgence. Maybe that was the term that was floating around as this idea of self-care entered into the culture a little bit more. Moving into the next decade, patients began to sort of feel like they wanted to have a little bit more interaction with their healthcare providers. They wanted to move away from a really firm hierarchy of doctors telling patients what to do, and moving a little bit more into patient-centric involvement in their health and their self-care. 2011 was the actual first International Self-Care Day. I believe it was started in the United Kingdom and has now obviously spread internationally, which was their goal. And the day was founded to increase all of our awareness of the significance of self-care and to equip individuals with the information and skills necessary to participate and create their own wellness. That's a little bit of a drive-by on the history of International Self-Care Day. When I talk to people about planning for their own self-care, thinking about what they might be doing to take care of themselves, a lot of people end up sharing with me in clinical sessions that I feel like it's selfish if I do something for myself. If I take time away from my family or my obligations or my kids, it feels selfish. And that feeling of it being selfish is a barrier to good, healthy self-care. And that's why in the beginning, I wanted to ask you, like, what are the feelings or the thoughts or your associations that you have when you hear the phrase self-care? Because it's not unusual that a lot of people, frankly, a lot of people who are very caring, nurturing, selfless, they give a lot to a lot of people. When they start to think about their own self-care, they have a little bit of that negative association that it's going to be selfish if I do this for myself. So just notice that. So we want to kind of drill down a little bit deeper into the difference between self-care and self-indulgence. And there's lots to be said about this, but I think that when we feel like it's selfish, we're thinking really what we're envisioning is being self-indulgent, being spoiled, being selfish, frankly. And so this gives you a little bit of a guideline on, is it selfish or is it self-indulgent? So in this slide, it shares the idea that, well, self-indulgence is the idea that we're obtaining something that we really want, to get, a bounce, to feel good, to avoid feeling uncomfortable, to postpone our obligations and responsibilities. We might get from these things a roller coaster thrill. It's like, oh, that feels great. I feel so much fun. That enables us to experience a momentary excitement that we might believe is not something we can have. Otherwise, our life might feel kind of dull. And so this kind of thing, maybe it's reckless shopping, overdoing alcohol and drugs, maybe overeating food that's not really so great for us. There's lots of ways. I will even say, cell phones, or devices, social media, can be a way that we're being a little, self-indulgent. It pushes away the world, and for the moment feels like a relief, but it also comes with this cost later on, whether it's a cost to our health because we overdid it. Maybe we overspent for that momentary, retail therapy high that we got. So then we get the bill and we're not, now we really have this downside to it. Or it can also harm our relationships. So if we're trying to decide, is this thing that I'm drawn to or want to do self-care or self-indulgent, this is a little bit of a template for you to think about, okay? Sometimes people will say, well, I've had a really hard day and I deserve to have this glass of wine. Or I've had a really hard day and I worked really hard and so I deserve to fill in the blank. If you're feeling like you deserve to do it, it might be that you're exhausted and stressed out and you're looking for a quick fix. And sometimes the quick fix feels like self-care when it really is self-indulgence. So we want to be really clear that when we're doing stuff that ultimately causes us harm, it's not self-care. Drinking your water, self-care. Self-care or self-nurturing ourselves ends up fostering a feeling of physical and psychological robustness, resourced, happiness. It's not like we're treating ourselves to something in the moment that's going to make it, the difficulties go away and ultimately be bad for us. We're actually addressing the needs that we have and attending to them in ways that will build healthy habits that carry us through the good times and the tough times. So that's my encouragement for you. If you take nothing away from this, remember that by the end of this, we're going to be talking about things that really are in the column of good, wholesome, healthy self-care. And I want you to be able to go into your life challenging yourself. Well, is this good self-care? Or am I just being self-indulgent that's going to boomerang on me later? So this is that slide for the difference. Now, there are some consequences of not taking care of our self-care, of leaning into self-indulgence too much because we are stressed out and we don't have a good self-care plan in place. And if you've ever experienced burnout or a period of extreme distress, you know what we're talking about. And I do think this picture kind of exemplifies it if you've been at the very end of your rope, as well as this picture. We know that a lack of self-care actually increases our stress. So if we already have a life that is demanding, and let's be real, stress is a part of life. We don't get to have a full adult life without a certain amount of stress, and it's not necessarily all a bad thing, okay? So being in a relationship, a loving, committed relationship, actually, it's demanding, sometimes stressful. Having children, love them, but let's be real, stressful sometimes, right? We wouldn't want to be without those things, but they come with increased demand. Having a career or a job, or maybe a couple of jobs so that you can cover all your expenses or the things that you want to do. Yeah, stressful. So it doesn't mean that we are going to get out of any kind of stress. It means that we need to have an equally robust and resilient self-care plan so that we can meet these demands of our full life. Because without it, our negative stress starts to increase. It can also contribute to poor physical health. We know that when we're not feeling in the flow or balanced in our life, that we, unfortunately tend to, stay up too late, not get the right amount of sleep. We don't eat so good. We don't, drink our water, don't do our exercise, all those things that are ultimately contribute to not feeling so well and can contribute, unfortunately, to some more chronic physical health problems. So self-care is really important for our physical health. We know that not having good, healthy self-care plan in place is going to have a negative impact on our mental health. And while I have those in two separate bullets, let's be clear, our physical health and our mental health are not separate little boxes, right? They are all interconnected, right? But having, an unhealthy self-care plan, we will start to feel increased anxiety, perhaps depressive symptoms. If we already have an underlying mental health diagnosis, it will have a negative impact on that. As we've said, sometimes it can lead to substance misuse disorders. So really challenging on our mental health as well. If you have ever been the kind of person who has been a sure, I can do it kind of person, the person who's sort of, yeah, I'll do it. Yep, I can help. And you do that too much without a good, healthy self-care plan, you might end up feeling resentful if it doesn't come back and it feel equal, right? Or you get a break from it. Resentments are a classic sign of not having a good, healthy self-care plan in place. So if you're noticing that you're feeling kind of cranky and, unappreciated, or, feeling a little resentful, that's a good little thing to notice, that maybe I need an improved self-care plan. It can also, as we can imagine, lead to relationship conflicts. Okay, so if we're not taking care of ourselves, we're not going to really have much really good gas in the tank to offer to the people that we care about in our life, that we want to engage with. So I want you to take a look at this self-care wheel. It's very colorful. Actually, I think money, I'm in the money zone with my shirt. I didn't plan that. In any event, the self-care wheel is a wonderful tool for you to use as you begin to think about creating your self-care plan for yourself. There's another version of this that you could print out. You can add different quadrants to this, but these areas of our spiritual parts of ourselves that are in need of spiritual sustenance, the part that is devoted to our work and our career, our education, cultivating that. We all need money, right? We got to pay the bills and save for things and take wonderful trips and do things. We have to have resources. We all need to take care of our bodies, our mental and physical health, friends and family. If we have a significant other, that can be human or a pet, our personal growth and fun and recreation. So what I'd like you to do is to think about, and you can draw this yourself and start thinking about, well, if you could move things around, like which one of those little sections of the pie would be the biggest right now? And sometimes we look at that, the biggest might be if you're in school, like a big chunk of that is career education. If you're working a career and you're really trying to grow your career, that might be taking a lot of the pie, pieces of the pie out. You might look at your money thing and realize, oh my gosh, I haven't really been balancing my checkbook that well. I've been overspending a bit, or maybe it is nice and robust. So you can take each one of those and give it a percentage of where is your attention right now. You might, I talk to, families and couples sometimes where, or, individuals where, they had all these friends growing up in high school, and they went to college, they had friends, and then they kind of got to the next stage of their life, and they're kind of like, yeah, everybody's moved away and everybody's busy. They got this and that little friendship slice is really narrow. They're kind of like, wow, I actually don't really have that many friends I get to see very often. That might be a good indicator that that part of your life is in a deficit that might need some attention. So use this self-care wheel as a tool for you to take an inventory of your life, the areas of your life that are doing well or maybe have been neglected and might need your attention. And this doesn't stay static, right? The wheel would look different when you're in your 20s than it would look when you're in your 30s or 40s, or name your number, name your decade, but it's always shifting, and that's okay. But we need to make those conscious, intentional adjustments to the self-care wheel. Now, the International Self-Care Committee came up with this idea of having 7 pillars of self-care. It's not 100% different from the self-care wheel, but it's a little bit different, and it's also very pretty. But we look at these pillars, and these kind of also remind us of some of the areas that we want to be paying attention in our quest for good self-care. Number 1, knowledge and health literacy. There was a time when, the doctors and teachers and, authorities were kind of like, they just told us what to do. And I don't know who's here and what your age bracket are, that may seem foreign to you, but there was a time when it was like we very willingly deferred to authority. Well, we don't do that so much anymore. We appreciate knowledge of experts and people that provide us with our healthcare, our education, but we also need to be partners in that. And that means we have to read and educate ourselves and know about our own health and what we need. So becoming knowledgeable of that is kind of part of our self-care. Not exactly as fun as maybe, going on a roller coaster ride, but it is really solid. It's a pillar. It holds us up. Mental well-being and physical activity, knowing that those 2 pillars are critical to our self-care. Without that, 2, 3, and 4, boy, the whole house is going to start to crumble. We have to be mentally and physically well, and we have to eat healthy, right? Risk avoidance. I think we can think about, like, well, what does that mean? And the picture obviously says, avoid the things that we kind of know because we've done our number 1, we've done our due diligence and researched, and we know, oh yeah, smoking's probably not all that good for me. Vaping's not all that good for me. Overdoing it in certain, consumptions isn't so good for me. Being too sedentary, not so great. So we want to, minimize that. Number 6, good hygiene, which we know to be basic stuff, like, we're going to brush our teeth, take care of stuff, do our doctor's appointments and all of that. There's also a part that I would like to include, and that is our sleep hygiene. If you're not familiar with that term, you can look it up, but there are some real fundamentals that go into making sure that we're getting good sleep. And I will say that is foundational to all of this. If you're not getting good sleep, you need to, examine that and maybe have a consult with your primary care provider so that you can improve that and start practicing good sleep hygiene along with the other good hygiene stuff. And number 7, a rational use of products and services. I actually didn't really know what that meant, but what it really means and what their intention is to encourage us to think about if we're prescribed medication, that we're going to take the medication as prescribed, right? We're not going to double up on something or, use it in an inappropriate way. But we're going to use the products appropriately and the prescriptions. So as I think we've drilled through a little bit, hopefully you all get this, that self-indulgence is not the same as good, healthy, mature self-care. It isn't selfish to invest in good self-care. We want to think about designing and creating our self-care plan. We are going to have to unplug. I mean, there's just no way around it. I don't know about you, but I find it really hard to, step away from computers and phones and social media. Interestingly enough, I just got, knocked off of all social media somehow, and I can't get back on. And I'm like, okay, maybe it's not a bad thing. So it's unplugging. We have to unplug so that we can actually tune into ourselves, using all our senses, reconnecting with what do we see, what do we hear, what do we smell and taste, and what are we feeling, using the body to give us a sense of like, well, what do I need, right? And in order to do that, we kind of have to unplug from too much news consumption, too much social virtual reality, and maybe even too much, socializing for a little while, right? Not completely, but enough so that we check in. We want to check in with our natural environment. We know that being out in nature is restorative. So at any time when you can get near water, look up at the sky, get out into the green trees, get your feet into the grass if you can, dig a little bit in a pot so that you plant some flowers. So these are all ways that restore us. Finding ways to express our natural human creativity is a really important self-care behavior. We are naturally and innately creative beings. And that doesn't necessarily mean that you have to be a fabulous, musician or a dancer or an artist, but maybe it means that, you're really good at making a meal for your family, or you like to, paint by numbers, or you like to, just make a garden or mow the lawn and have it look really, tidy. Any kind of thing that is, you taking your energy and making it into something is creative. Anytime you can find a way to laugh, it's going to be good. It drops lots of dopamine into the system, and it is good for your well-being. And we'll talk a little bit more about mindfulness in a second, but so we talked about, the hazards of not including self-care into your life, but there are lots of benefits, right? So sort of the opposite of the burned out matches. But we know that, people who have healthy, good, robust, balanced self-care plans in their life are better at performing pretty much anything that they're trying to become good at, whether it's performance at work, taking care of your family, challenging yourself to some thing that you want to achieve. Maybe you want to run a 5K, maybe you want to, do a, I don't know, mutter or some kind of physical challenge. Your self-care plan's gonna let you do that. It's gonna make you better at it. You want to go back to take a class, write a paper, finish a project. All of that is going to be better when your self-care plan is in place. It's going to help you feel confident and resilient. You're going to have more energy to do what you want to do. So I think we built the case pretty clearly that self-care is not selfish and it's really good for you. Whoops, I'm gonna go back. Go back a minute. Where's my thing? Okay, sorry. I didn't see that, Angelica. I am going to wrap up. A couple of different kinds of self-care that might be interesting for you to look at. And going to move through some of these slides a little bit. They'll be available to you when you get this. These are important slides. All of this will lead you to having more resilience, okay? So resilience is the end result of good self-care, and there's lots and lots of ways that you can do this. Of course, we know sleep, exercise, meditation. You can practice gratitude. You can practice mindfulness. This is a beautiful exercise that's called See, Touch, Go. That is a mindfulness practice, and it's really simple to try it anywhere. If you're having a rough day, if you're feeling a little stressed out, let yourself just see the struggle that's there within you, around you. Just acknowledge it. Touch your heart, put your hand on your heart, and mentally or even physically, if you can, put it on your heart. Sensing into the area of the body can actually help turn down the volume and the chatter in your mind and connect you to, what really matters in this moment. And then we go from there, go from the heart. Ask yourself, what do I need in this moment? And what really matters? What actions will align with what I need or what matters? And then do your best to go and do that. Sometimes if all we do is put our hand on our heart and wish ourselves well, it's a moment well served for your self-care. So I'm wishing you the best of self-care.
We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link has been added to the chat for your convenience. And thank you again, Sharon, for dedicating your time and your expertise today. If you have additional questions or comments, you can send an email to communityhealth@atlantichealth.org. And that concludes our webinar. Have a good day, everyone, and thank you for joining. Thank you, Sharon.
Thank you, everybody. Thank you, Angelica.
Mhm.